Let's turn to the race to get Americans vaccinated against the coronavirus. It's now facing a big weather challenge this week, as you can imagine. Yesterday, White House Press Secretary Jen Psaki said, quote, "We are experiencing delays in COVID-19 vaccine shipments and deliveries. CDC and federal partners are working closely with the jurisdictions as well as manufacturing and shipping partners to assess weather conditions and to help mitigate potential delivery delays, and cancellations." According to local health officials, many vaccination and testing sites across Texas closed over the weekend and earlier this week. Mississippi and the Memphis area also closed down vaccination sites, while Washington state estimated 90% of this week's vaccine shipments will arrive late. Joining us now, former FDA Commissioner Dr. Scott Gottlieb. He is a member of the board at Pfizer. Dr. Gottlieb, great to have you back on the show. We can talk about some of those delays, but also let's talk big picture about how production and distribution of the vaccines is going right now. We had New York City Mayor Bill de Blasio here yesterday morning expressing his frustration, saying, "I'm ready to go. I've got the Javits Center up and running. I've got all these places I can get shots into arms. I just don't have the doses I need." So where do you see the bottleneck here?
Well, look, I think the bottleneck probably is supply right now. We've done a good job growing the distribution. The federal government right now, the Biden administration is pushing vaccine out through some of the federal partners that they have, the big box stores, the pharmacies and community pharmacies, and also the community health centers, which are in underserved communities. So they've opened up new routes of delivery for vaccines. So I think the footprint around the country that you can distribute through is much broader right now. You know, supply is still constrained, but it's been growing every week. I think we're going to be close to a 15 million dose a week run rate as we get into March. So there's substantial supply coming online. Once we get into April, supply should ramp really quickly, especially if J&J gets its vaccine approved at some point in March. I think we're going to have more supply than demand as we get into April, and the equation is going to start to change. But right now, we're still supply constrained. I think we're going to continue to feel that for the next 3 or 4 weeks. But as we get into the later weeks in March, I think we're going to start to have a lot of supply, and you're going to see slots open up.
We heard from Dr. Fauci earlier this week saying he believes by April, as you sort of indicated there, that things will open up and that people who want vaccines should start to be able to get them. Healthy people who want vaccines should be able to start to get them. President Biden also said he believes by January they'll have enough for everybody who wants it, and perhaps looking toward fall, there could be some return to a version of normalcy. Does that timeline line up with what you're seeing?
I think it does. I mean, Tony changed his forecast a little bit, and the president had said July. But what I'm looking at is that by the end of March, we're going to have 220 million doses that have been put in the market by Moderna and Pfizer, the company I'm on the board of. Not all of those will get used. There'll be some doses still making its way through the system. But by the end of March, there'll be 220 million doses that'll be manufactured and shipped. If J&J does get authorized, and I think they will, they'll probably put another 30 million doses in the market over the course of March. So you're talking about 250 million doses at that point. If you assume a 60-40 split in terms of first doses and second doses, about 60% goes to first doses, 40% goes to second doses, that's potentially 150 million doses you can deliver. You're not going to deliver it all because not every dose that gets manufactured in the last 2 weeks of March is going to get into an arm. It's still going to be in a supply chain somewhere. But even if you can vaccinate upwards of 100 million people by the end of March, which I think is possible, you're working off a lot of the demand. A lot of the people who are willing to line up will have already been vaccinated. And I think we'll get to 125 million people with some cajoling. But once you get to that number of people, 125 million Americans vaccinated, I think the next 25, 30, 40 million people are going to be more difficult. And that's where demand starts to become a little bit more slack, especially in an environment where prevalence is declining. So people see infection rates coming down. They're not going to be as eager to go out and get vaccinated. So I do think you're going to see the equation start to change, and it'll change quickly.
Doctor, let me ask you about the science of the vaccine, what you know so far, what the medical community and science community knows so far. If somebody's vaccinated, let's say they've gotten both vaccinations, they obviously will still be wearing a mask. But what is the possibility of them actually picking up strains of the virus and passing them along to somebody else? Is there any evidence that that could happen?
Well, there's evidence now that suggests that the vaccine reduces your likelihood of getting infected and reduces the likelihood that if you do get infected, that you'll transmit the infection. The clinical studies were designed to show that the vaccines reduced the signs and symptoms of COVID. So people didn't get sick, or they got sick at a much lower rate, but it didn't assess whether or not it reduced them from getting infected in the first place. But there is accumulating clinical evidence now that suggests that people are less likely to get infected and less likely to transmit the infection. I think the conventional wisdom is that that's true, and what needs to be worked out is what the magnitude of that is. But we haven't established that. It's not in the drug's label. Ultimately, the manufacturers are going to need to file supplements with the agency to be able to make claims around those attributes. But I think if you talk to most researchers, they believe that there is some effect on transmission, some effect on infection, and they just don't know the magnitude. Some think it will be quite profound. Others think it might be more subtle. So there is some debate around that right now.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.